Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban. And on this episode, you definitely want to check in. We're going to be talking about a weak jaw, weak chin, weak neck. I hear about this all the time. Patients are inquiring. You're going to get all the information you needed to know. So definitely tune in on this episode of Plastic Surgery Uncensored. Welcome to another episode of Plastic Surgery Uncensored. As always, I'm your host, Dr. Rady Rahban. And today we are very lucky, as I am blessed and honored to have one of my very favorite patients along with me, Olivia. And she's going to be, she and I are going to be talking about a really important topic. It's interesting. I think this topic has always been really important, but I think in the era of photography, selfies, and now Zoom, I think it's even more relevant than before. And it's the whole concept of the jaw, one's sense of self in terms of having a weak jaw or not a prominent jaw. And again, this is something definitely that's not new, but has always been a concern, but now I think is heightened given how much visual, confirmation we get. So welcome, Olivia. How are you?
Hi, good morning. Thank you. I'm well. Thank you.
As always, you look gorgeous. We're happy to have you, and thank you for participating.
Of course.
Because I think this is a topic that, of course, was important to you, but I hear this topic probably 100 times a month, more than I hear almost other topics because of how important the framework of the face is. So let's talk a little bit about your journey. So, because I think what happens is this is one of those topics where people converge. In other words, they come to me with different concerns and often are not sure what the issue is and describe it the way they see it, but ultimately it ends up being in the same place. So if you don't mind, tell me a little about your journey in terms of your self-awareness and the things that bothered you.
Yeah, totally. It's really interesting because if you would have asked me like 5 years ago, would I even have thought I had a weak jawline or a weak chin? I mean, I would have agreed. My earliest memory of acknowledging or like noticing my chin was as early as 8th grade. But it wasn't really a thing, or I don't know. I feel like there wasn't a lot of hype about a strong jawline, or as a consumer, I just didn't know a lot. So it wasn't until like the past, I don't know, like 4 or 5 years, I feel like when like Khloe Kardashian did Kybella, that was kind of like the first time for me that I heard, okay, other women have this problem, a strong jawline, a chiseled chin, like we want that. And it's not masculine. I feel like I always kind of thought it was, and it's really not. So my first like go at it, I tried Kybella, and that was just horrible because I was really swollen and it stung, and I have a very high pain tolerance, so that was unbearable. And then like after 2 months, like the swelling gone down, nothing changed. So when you kind of flirt with the idea of making a tweak, at least for me, and then you experiment and it doesn't go anywhere, right? Like you try it and nothing changed, you kind of get like more, you're frustrated. And I was frustrated. So I was like, okay, let me try something else. Let me try Morpheus, let me try RF. And Morpheus was very painful. Nothing happened. RF, nothing happened. So I was doing all these different like non-invasive therapies. Nothing was working. And then I was kind of like, okay, this is now an issue. I feel like it's an issue. I had a friend who was like doing just lipo. So by the time that I came to you, I didn't per se knew that I was going to be getting a chin implant. Like I didn't know that I needed that. I just kind of, now when I look at photos and I'm educated, I needed one. But I was just like, okay, I just need lipo because I have this stubborn fat. I'm skinny. So that's kind of like where I was. So by the time I came to you, I was like, you know what? I need to just go under. I'm ready. Like I've tried all these different things. I'm ready to just be more aggressive and let's just get it right.
All right. I think my gosh, you hit on so many topics. I was chomping at the bit, but I'm working hard on letting patients finish patients. I'm working hard on letting other people finish their sentences. Yeah. So beautifully described. You hit on a lot of things. So I'm going to highlight some of them. Number one, this idea that in general, a strong jaw is a masculine feature is so far from the truth. So what I do often as an experiment with patients that they come in is, when I notice that part of the issue, often they complain that I feel like my neck doesn't look really good. I feel so let me back up one notch. Most people complain that my neck doesn't look really good. It doesn't photograph well. I have a double chin. I don't feel like I have any distinction between my jaw. It really presents itself that way. Very few people come in and say, oh, I think I need a chin implant. Maybe now because they're educated, but much fewer. Almost always the target area is the neck, when in reality, the issue often with the neck is the jaw. So then they come in and I kind of look at them and I assess, wow, this person would benefit. It can be subtle sometimes. The assumption needs to be made that if I'm going to get something, it needs to be dramatic. Farthest from the truth. It can be the mildest, most subtle change. And all of a sudden you're like, holy crap. Oh my God, this looks amazing. So we have magazines in the exam rooms, and I'll grab a magazine and I'll basically cover the top half of all the models' faces. I'll just grab a random magazine like Cosmo, and I'll cover the top half, and I'll just flip from photo after photo after photo of models, Asians, Blacks, Caucasians, Middle Eastern, it doesn't matter. And one thing that's common with all of them is when you cover up their eyes, they all have masculine, quote unquote, jaws. What does that mean? They have really strong jaws. And a strong jaw is non-gender related. In other words, it doesn't matter if you're a man or a woman. Having a strong jaw, and I'm not talking about Jay Leno jaw, is desirable and attractive in men and women. So that's the first thing you hit on, which was excellent, which is this idea that I thought having a stronger jaw was essentially somehow a masculine feature. Farthest from the truth. It makes women so beautiful. Second issue is that you notice that you did a lot of non-invasive things, which is not uncommon, right? You're a young girl. The last thing you think in your mind's eye is you're definitely in shape. You're not overweight. So let's start with that. So sometimes indeed your neck or jawline is obliterated or isn't as defined because you're a little overweight. So let's say you're 5'3" and you weigh 165, 170. Well, you shouldn't be surprised that your jawline, amongst other areas, are not as defined. But when you're 5'4" and you weigh 125, or 5'4" and you weigh 135, then you're not overweight to the extent that your face should be full and your neck should be non-existent. So it's natural that people start out considering non-invasive procedures. Like, you don't just run in and get surgery. So you do the things that you did. And so common right now are these procedures that remove fat from the neck. You name them. You named 2 out of the 4. Kybella is so popular, which is, in my opinion, I don't even understand the concept of it. You're injecting some material, some liquid underneath the neck, which causes it to get super inflamed. You look like a bullfrog. You got to do 5 sessions of it in order to remove a little bit of stubborn fat, which in my opinion, usually isn't the issue. So you did that. It didn't work. Mm-hmm. Morpheus or RF or radio frequency is to remove fat, which again hurt and you didn't work. Cool sculpting on the neck, removing the fat. Or Ultherapy. And all these devices, and there are many more, are designed to get rid of fat under the neck. So fat under the neck can sometimes be a contributing fact to having a weak jaw, but it is seldom the only issue. Seldom the only issue. And if you remove the fat from under the neck without addressing the other issues, you're often exchanging one problem, a little bit of fat under your neck, with another, which is now I got this loose skin that's duplicated and looks unattractive. So you hit that on the head very well, which is I did these other procedures and they just didn't work. So let's get to the definition first so we understand. A weak jaw is essentially defined as the mandibular angle, which means the corner of the jaw, the border of the jaw, which means the whole length of the jaw, the chin itself, the neck and submental area in contour. And believe it or not, in my opinion, it also has to do with your cheeks. So all those things contribute to having a chiseled or a defined jaw and neckline. So when you look at models, because you got to work backwards, and I'm not suggesting that everyone needs to be a model. Everyone knows that I don't suggest that, but we look at them as a kind of a reference point. And you say, okay, well, where am I relative in terms of my jaw? It looks like my neck bleeds into my face, bleeds into my neck. So you want to have a reasonable angle of the jaw. You want to have a nice jaw line. You want to have a stronger chin presence. and you want to have a sort of an emptiness underneath your neck and some gauntness a little bit in your cheeks, so your cheeks don't fill right into your neckline. So those are the things that I look at. And often people who present with excess fat in their neck also have a weak chin. And so let's go back to you now. And let's say you came in and you're like, I'm over it. I don't know, something's going on with my neck. I'm not super stoked with it. And I've done a bunch of things and nothing's working. So what did you and I discuss? And let's go over how we came from to you. So what did we talk about?
Yeah. So I just remember when I came into your office, like I knew that I wanted lipo of the chin. I walked in there and I was like, I'm getting lipo of my chin. And so once you kind of started, you know, we were discussing and you were educating me, you know, if I do the lipo of the chin, I could potentially have loose skin, because it's not just as simple as removing the fat from my chin, that I did have a weak chin.
Okay, so hold on right there, because that's so important. So often when you have a weak bony jaw, I mean your jaw portion, the bone is weak, you will have duplication of skin under your neck. So they go hand in hand. Just imagine, everyone at home right now, stick your jaw out as far forward as you can, and you'll notice that whatever fat or redundancy of skin you have underneath your neck disappears. And then pull your jaw neck all the way back into itself. And all of a sudden you have this double roll, turkey roll underneath your neck. What does that mean? It means that a lot of your redundancy or inadequacy underneath your neck has to do with how much bone you have or how much prominence you have in the bone, its mandible itself. So any procedure designed to remove fat from under your neck without doing anything to the bone itself, often, and more often than you think, will lead to loose skin under the neck. So again, if you have a strong jaw, bone-wise, and you have fat under your neck, no problem. But most people that have fat under their neck also have a weak bony jaw. So whether it's Kybella, cool sculpting, liposuction, all therapy, whatever, when I remove the fat from underneath my neck, right underneath my jaw in my neck, and I do nothing to the bone and I'm slightly weak, which most people are, I shouldn't be surprised that in 1 to 2 years, I'm like, what the hell is this band under? Oh my God, what is this loose shit under my neck? And I did a facelift in a 39-year-old 6 months ago who had literally loose skin hanging on her neck, like if she was like 67. And why did that happen? Because she had had aggressive liposuction done under her neck 2 years earlier, because at the time she just felt like her neck had some double chin fat. She just had that fat. So go ahead. Yes, you said that you were hell set on having lipo under your neck. And then you and I had a little bit of an academic conversation.
Yeah, we had quite a large one, which was honestly, it was great because once you had explained the anatomy of that, and just like the logic behind that, I got it. And I mean, once I had, like I said, I knew my chin was weak, but a chin implant, I feel like it's weird. It's kind of, and it shouldn't be weird because like the chin needs some love too, but it just felt like it was just foreign, but once we talked about it and you're like, no, it's not masculine. It's really going to just accentuate, contour your features. I just knew that that's what I was going to do. I didn't want to put a Band-Aid on a problem. And I was very worried that if I didn't listen to you, that I would be, operating twice, or I just like at the end of the day, I just wanted to have a comprehensive, plan about what I wanted to do because I was very frustrated before I came to you and I was tired of being frustrated, like I just wanted to just go for it and give it a shot because I wasn't happy.
Yeah. And I think that's really important. The bottom line is that you got to have an understanding or knowledge. That's what this purpose of the podcast and the purpose of this topic is, for people to understand a little more knowledge about the subject matter, and jaws and chins, and that whole subject matter is a little confusing. That's why we call this segment the weak jaw, because it's not necessarily a weak chin. It's not necessarily fat under my jaw. It's the concept in total is a very confusing one. And it requires a good discussion and analysis and pinpointing the problems. And like many other things we talk about, there isn't a single solution. You don't just go in and go, boom, put in a chin implant, call it a day. Sometimes yes, sometimes no. And we'll go back and we're going to take a break for a moment. And then what we're going to do is going to come back and I'm going to describe each of the individual procedures that are available in more definition as to what is a chin implant, what is submental lipo, what is fat grafting to the jaw, what is buccal fat removal. And we'll get back into those details, but it's really, really helpful to understand that this is more complex than one initially imagined. So make sure to come back after the break and hear the rest of this amazing topic. All right. Welcome back to the second half of this, our episode of Plastic Surgery Uncensored. I'm here and joined with Olivia, and we're going to be talking a little bit more in detail about our subject, which is the weak jaw. So on the first half, we talked about the general concept. So let's dive in specifically and talk about each item. So anyone who follows me knows that I love chin augmentations. I teach the course on chin augmentations. I think they are amazingly powerful tools when used correctly in the right person. And so let's talk about them in general. So unique parts about a chin aug. A chin augmentation is an implant. It's solid. It's silicone. It's hard silicone, not soft silicone like a breast implant or implants elsewhere. It's a solid block of silicone. It is permanent in that it doesn't have to be removed. It is reversible in that it can be taken out. These are two very unique qualities about a chin implant that is different than other things. So for example, a breast augmentation is, yes, it's reversible, but you never really look exactly the same way you did once you put it in. And it definitely isn't permanent. There are two approaches to a chin implant, which is you go in through the chin itself, through the inside of the mouth, or from the outside. I do not advocate ever going in through the inside of the mouth. I think that approach and technique has a lot of issues associated with. The easiest of which to understand is you're taking a permanent sterile implant and you're sticking it in saliva. So my recommendation is always to go from the outside. The incision is tiny. How big is your incision?
Tiny.
I mean, it's like, I don't know, a centimeter at most, and it disappears beautifully. There are different shapes, there are different sizes. Your surgeon will select one that's appropriate. When you are subtle and you need something small, we have very small implants. When you are super weak and you need something large, you have very large implants. So it is not an all or none phenomenon. It isn't like I get a chin implant, I look like Jay Leno, right? It doesn't work that way. It is, I get a chin implant and it is tailored to what I need. And it's a very reasonably quick surgery. The recovery is easy. And did you find the recovery to be challenging? Was there anything in specific from the chin augmentation standpoint that you felt like, whoa, I mean, share what you thought about that aspect of the recovery.
Yeah. I had other things going on. I thought the recovery for the chin was pretty turnkey. I mean, I didn't think it was painful. I was fine. Little bit of discomfort for maybe 48 hours. I didn't need pain meds. I was fine.
Yeah. So, I mean, the point being is it's surgery. It's not nothing, but it's not something massive or major when done correctly. So that takes care of the chin implant. And in many instances, the chin implant is the cornerstone of creating a strong jaw. In other words, if you look at a jaw as a tent, meaning the angle and the angle are the bottoms and the chin is the top of the tent, the taller the tent is, the more stout and rigid the walls are. So you cannot even begin to make a nice jaw and neck without a strong chin. Forget about it. There's no point in even considering it. You can do all the injectables you want and suck out all the fat you want and do whatever the hell you want. But if you don't have a strong chin, game over. So that's why I think it's really important and crucial that that be the cornerstone of your dialogue. If you have one, great, but many people don't. The second thing we did is in conjunction with the chin implant, we removed a little bit of stubborn fat under the neck. Now, notice how I said in conjunction. So we did submental lipo with the chin aug. I seldom ever do submental lipo without a chin implant because of what we just talked about. So unless you have an amazing jaw and just happen to have some fat under your neck, most people with fat under their neck have a weak chin. So if you just suction the fat and don't put a chin implant in to recruit the excess skin, then you get excess skin. So we did a little bit of contouring in that regard. And then the other thing that we did was we sculpted your jawline with fat, right? Mm-hmm. And what did you think about that concept when I first brought it up?
You know, honestly, I thought it was a good idea. Had
you heard about it? I mean,
I'm just trying to think about it. I never heard about it, but once we were talking about it, I was just willing. I mean, I just knew that you knew what you were talking about. And when you educated me about it, I was just game on, you know?
Okay. So what we did was, and I think this is important, and this is where the building a beautiful jaw advances, is so we put a chin implant in, awesome. We took out a little bit of fat along the neck, awesome. But then you don't just magically create a jawline. And then what I do is I take a little bit of fat and I prepare it and spin it. And then I inject that fat very delicately and skillfully in areas where I want to accentuate the jawline. Many people, including myself, as we age, develop a little bit of marionetting, meaning the little line that comes down. We get a little bit of jowling, even in our early ages, and we don't have the most crisp jawline. In other words, from your chin to the corner of your angle, you want a relatively straight line. You don't want all these lumps and bumps along the way. And so the fat transfer kind of helps, if you will, it's like sanding down, and it cleans up the line of your mandible to hence create a smoother, more beautiful contour. And we did that with you as well. Now, the last item that I do often in this, I call it the 4-prong approach, which we did not do with you, is I often take out a little bit of fat in the cheeks from the buccal space. Because again, when I look at most patients with a weak chin, most patients with a weak jaw, they present with one or all 4 of these items: a weak chin, fat underneath their chin in their mental space, a weak jawline, and then some very full cheeks. And what happens is the last phase is, in those instances, you can go in through the inside of the mouth and do what's called a buccal fat removal, where you're just taking out and teasing out a little bit of fat through the inside of the mouth. And you're trying to break up the cheek from the jaw so that your cheek and jaw are not one big round ball. In other words, if you look at the ideal structure of a jaw, there's a break. You know, women use, I think it's blush, to kind of accentuate the cheekbone, the hollow, and then the jawline. And, you know, you can look at Angelina Jolie or Megan Fox or anybody for that matter, and they'll all have that element. And so we take a little bit out. Again, none of these things in isolation are going to be very effective, but the sum total of these things in the right patient done with the right recipe can be incredibly powerful. And all of them are subtle. Mm-hmm. None of these things are over the top or dramatic. And the idea is like, oh my God, you did all that? Yeah, I did a whole lot of little bits rather than one really big bit. And, you know, of course, in terms of harmony and balance, I suspect you will look significantly better if you do several little things than one big thing. So give me your thoughts while we're wrapping up here on this subject, because I think it's great. Let's talk about how it's impacted your life, how you feel, what people have said. As a whole, are all your close friends and family going, oh my God, what did you do? You look so weird.
You know what? No one, it's the most subtle difference. And if you're not, I mean, even my closest friends that knew or some that didn't, I've gotten mixed reviews. A lot of them couldn't tell. Some of them did because they knew what to look for. But ultimately, it's really just a thing with me. Like, to the side, it's just such a little enhancement, but it's just gone such a long way. So I'm so happy. I mean, I feel like it's the tiniest little subtleties, but overall, I believe it's very naturally enhanced just the harmony of my entire face.
Do you feel more confident? I mean, do you feel like it? Because ultimately, I think what you did was you hit it on the knot. What I hear often is, this is what I hear. Yeah, but this sounds so extreme. I don't want anyone to know. I'm afraid it's going to look too dramatic. Right. So I think by looking at the photos and speaking to patients, when things are done correctly, I underscore, it can be and should be incredibly subtle, to the extent that most patients, friends, and families are like, you did what? I don't really see the difference. More often than not, people say, oh, you look like you lost some weight. You lose weight because your neck becomes more defined. And the number one place you see lost weight is in the neck and jawline area. So that's common. But why are you doing this? You're doing this so you and only you feel better. And if you feel better, then who gives a shit what everybody else says? But the question is, do you feel better?
Yeah, night and day. I'm so much happier. I feel so confident. I'm not worried. I mean, it's like the problem was gone. And again, when I came to see you, I was like, I'm getting lipo, and that's, that's certain. And when it obviously was a lot more intricate and a lot more advanced than I thought. But once we were discussing, I just kind of was like, just give it a shot. I mean, I feel like there is a lot of other, just things going on. So the most subtle, natural surgery. I mean, I did not anticipate that. I mean, I was really confident with you just because of the many discussions that we've had, but very subtle. I just feel so much more comfortable in my skin. And when I turn and have a nice side profile, I really like what I see. I don't look away from a photo now, whereas as opposed to before, I was kind of nervous seeing like my side profile because I was looking at that fat. I mean, we kind of look at our like our insecurities on film or just whatever. So I'm really happy. I feel really good. I'm so happy that it's subtle and it's made the world of difference for me, because now I don't have to worry about it. I mean, I just did what I wanted to do, and, it was just really turnkey for me.
Yeah. And I think that's really the underscore, the sort of, if you listen in constantly to the podcast and you listen to patient journeys, and the goal ultimately is it's not for you to be a supermodel. It's not so that your husband, boyfriend, mom, dad thinks you look good. And it's so that when you are engaging in your day-to-day activities, you are no longer mindful of that area or thing that was causing you insecurity. And this idea or notion that, insecurity, you should just get over it is ridiculous, because there is no human being on the planet, none, zero, no therapist, no rabbi, no life coach who doesn't have an insecurity when it comes to the way they feel and present themselves to the outside world. And so when you have the ability to do something that is safe and sound and practical and get a good outcome, and the net result is, holy shit, I feel great. I can get into that Zoom conference looking wonderful. I can have that, go on that date and not worry, then kudos to you. So thank you so much for coming. I know that every time I have a guest on, particularly somebody who is courageous enough to have the conversation, it's really meaningful, because I think that, you represent probably hundreds of thousands of individuals, but unfortunately not everybody is open to having their own conversations, but certainly are appreciative of you willingly and sharing your experience. So thank you for coming on.
Thank you so much.
All right. Well, that wraps up another episode of Plastic Surgery Uncensored. Make sure to tune into our next episode, because I'm sure whatever it is, it's going to be interesting.